I am Dr. Malik, intensive care specialist. I have done a lot of videos before also. You must have seen them. Today I want to talk about an important topic which comes to the emergency department. This is called cerebrovascular accident. Cerebrovascular, CVA, cerebrovascular accident. Usually that means the patient has some bleeding inside the brain. Usually this happens. Cerebrovascular accident. Usually it is because of high hypertension. Usually we come across. See, there are other conditions also where you may not have hypertension to the patient, where you may not find BP to the patient. BP may be normal, but 90% of the cases what we see today early morning at 4 o'clock also we have seen one case in a bad shape. The patient came in a very bad shape. The patient came in a very fully unconscious state, very difficult breathing, and pulse was very slow. BP is something like 200 by 120, very high. Pulse was very slow, like 41, 42. This is the usual scenario. So what is happening to this patient is, patient has, because of high hypertension, because of high BP, the patient has bleeding inside the brain. We can clearly see it. By examining the eyes, we can say whether the patient is having bleeding inside or not. After that, we send the patient to CT scan, etc. First, we stabilize the patient, we reduce the BP, we give drugs like mannitol, etc., to reduce the brain pressure in the brain. To reduce the pressure in the brain, we give injection mannitol, etc. Okay, that's all medical management. How do we prevent it? The main problem is the patient was taking, I asked the patient attendants, is he taking any BP medicines? They said, yes, he's taking BP medicine, but daily morning he takes. This is what is happening. In my previous topic about hypertension also, I said the same problem. So the thing is, somebody writes a BP tablet for you. There are plenty of BP medicines, for example, beta blockers, calcium channel blockers, centrally acting drugs, diuretics, etc. Another 3-4 things are there. We hear so many BP tablets by Metexcel, Atenolol, Telma 40, amlodipine, Stamlo, etc. Amlodipine is nothing but Stamlo. So many drugs. Nowadays, latest drugs are also there. There are so many, at least 10 varieties of drugs are there. Usually, why so many drugs are there to the BP? Yes, BP is simple entity. If we think that BP is a simple entity, why do we have so many medicines? The only thing is, it is always hypertension. BP should be treated like single drug regimen, 2 drug regimen, 3 drug regimen, 4 drug regimen, like that. We should go like that. First, with any doctor, first you go to the go with hypertension 3 to 4 times. He will check BP on 3 to 4 consecutive days. Then he will put you on one tablet, BP tablet, and he will observe you. He will be seeing BP. Once the BP comes down below 130 by 90, 130/90 or 140/90 is the maximum allowed. We should not allow the BP to go above 140/90. 140/90 is the cutoff point, maximum point. Usually we maintain around 120/80 or 130/80. We don't allow the systolic upper thing to go above 140, and lower thing. Upper is called systolic, lower is called diastolic. Systolic should not be more than 140, diastolic should not be more than 90. So 140/90 is the maximum allowed. That is also, we tell them, be cautious. So your BP is 140/90, you may need extra medication. Okay, so first we put the patient on one particular drug. Among the so many medicines, we put the patient on, for example, I keep a patient on Telma 40, for example. I am taking you. We use Telma 40 for some days. If the BP comes down to normal, morning, evening, we check morning, evening. At least if the patient can check in his house, he can have a small BP machine. They can check. And if it is below 140/90, it's okay. So if it is not coming down with Telma 40 or single tablet regimen, then the patient comes back to us. We add another drug, for example, beta blocker, some Metexcel 50 or Atenolol, Aten 50 or whatever it is. This is how it goes on. Single drug, 2 drug. Next, if with two drugs are also not sufficient. We ask the patient to take one tablet in the morning, one tablet in the evening, and add another third tablet also if needed. See, I told you in my previous video, in my first few videos, that I was a hypertensive. It was not coming down. I was using 4 tablets, 4 different varieties of tablets, morning 2, evening 2, to control my BP. It was not getting controlled. So then I have changed my diet habits, exercise, etc. In my previous video, in my first video 1, 2, 3 introduction, and second and third video, you can just see how I could reduce my BP, almost how I could bring back my duty. I was taking 4 tablets, now I am taking only a single tablet. How I could come back from 4 tablets to a single tablet, you can see in that those videos. So you can see, you have to go on increasing the medication and ask the patient to take dietary precautions, little exercise, etc., and then you can slowly come back also. It is not like that once you increase the tablets, he will be permanently on those tablets. BP is also a reversible problem. Why BP comes? Why BP comes is usually what is exactly BP? I want to tell you this. What is exactly BP? BP is the resistance in the blood vessels. Heart, when it pumps, the heart blood vessels will dilate. The thing is, heart is pumping into the blood vessels. So these blood vessels, when the heart is pumping, they dilate and take the blood, and vice versa. These blood vessels, they dilate, they constrict. They dilate, they constrict. According to the heart blood flow, they dilate, they constrict. They dilate, that means they act, they relax. The blood vessels, heart is continuously pumping and relaxing. Okay, and these blood vessels, they are also going to spasm and relax, spasm and relax, spasm and relax. But in blood pressure, when the BP is, why the BP is going up is the heart blood vessel, the blood vessels in the body, they are compressing, but they are not relaxing, not completely relaxing. If they completely relax and then contract, completely relax and then contract, blood pressure will not come. When the blood vessels are not completely relaxing because of these factors, maybe some other factors like your dietary factors, cholesterol, whatever it is, there is plenty of factors for it. Maybe hereditary, or your kidney problem can cause BP. Your hereditary thing can cause BP is also hereditary. So there are so many factors which cause BP. So the thing is, the blood vessels, they contract but they don't relax. They do relax, but they don't relax completely. If they completely relax, blood pressure will not occur. They will be not relaxed. They are not relaxing completely. They are contracting and not relaxing completely. That is the problem. So whatever it is, once the blood pressure, there are plenty of medications, about 7 to 8 varieties of medicines for BP. Only thing is, you have to monitor your BP regularly. Otherwise, there is every chance. This CVA is the worst problem that can happen to the patient. There is one blood vessel in the brain, it bursts. You will have plenty of bleeding in the brain. That is called, in the morning 4 o'clock that happened. The patient had hell of a bleeding inside the brain. I kept the patient on ventilator. Neurophysician is taking care of him, but I don't think the patient is going to survive because the bleeding is so much. And one more problem is, it is not like a road accident. Suppose a road accident is there where there is hemorrhage in the brain, it can be removed. But this case, particularly in hypertension and other cases, CVA, you cannot do surgeries. It is a medical problem. You cannot do surgeries because there are bleeding at so many places inside the brain. Surgery is not, 90% of cases nobody will attempt surgery. Very rarely surgeries are done. So surgery is not really indicated, but in some cases, experts may take their own opinion. But my opinion, I say 99%, 90% of the cases, surgery is not indicated. Only thing is, it should calm down on its own by medication, and it takes a lot of time. The patient will be completely in paralysis. So one side or both the sides, This is very dangerous, but please don't land in this condition. Take care of your hypertension by regularly monitoring your hypertension. That is very, very important. One drug, two drug, three drug, four drug, it doesn't matter. You just follow the guidelines, which dietary guidelines which I have given in my video 1, video 2, video 3 of mine. Please, you will come back to my stage. I was taking 4 tablets for hypertension. Now I am on single tablet. Probably in another 1 year I may not use that tablet also. I may come. Now I am above 60. I am 61 is my age. So automatically